Good evening. We are now just past the halfway mark when it comes to the 21-day nationwide lockdown to take on the spread of the coronavirus or COVID-19. Right now, 79 people in India have died after being infected with the novel coronavirus or COVID-19. There have been 472 cases in the last 24 hours. The total number of cases now in India stands at 3,374. The doubling rate, that is, how many days it takes for the number of COVID-19 cases to get doubled in India, is 4.1. That means every 4 days the number of cases, positive cases in India doubles. But the good news is that the ICMR has confirmed that COVID-19 is not airborne. So every day there are new updates and studies and policy changes when it comes to tackling COVID-19, and to help you keep up, to help you keep pace, we have this show for you where we bring you the best in the business, the best doctors, the experts. We get them here on our shows to answer any questions and queries that you may have about COVID-19. And today we have Dr. Ashok Ratan, who is the former laboratory director at the WHO, Pan American Health Organization, of course, and we also have Dr. Jyotsna Agarwal, professor and head of Department of Microbiology at the RML Hospital in Lucknow, joining us. First and foremost, if I can start with both of you doctors, the big story, of course, today is the US President requesting Prime Minister Modi to remove the ban on the export of hydroxychloroquine tablets. And I can tell you that since then, everybody's been Googling these tablets. What are they? I thought they were meant to treat malaria, but now everybody seems to be wanting them. If you walk down to chemist stores, which still are open because they're essentials, you see all these stores saying they're sold out of this. What is hydroxychloroquine? What is it treated for, and can it actually treat COVID-19?
Yeah,
Dr. Ratan?
Yeah. Chloroquine or hydroxychloroquine, it's an anti-malarial drug. It's long-acting. One tablet will last for about 21 days or so in the blood, and it is also anti-inflammatory. So I think it is acting against COVID-19 because the death occurs as a consequence of cytotoxin produced, which is known as cytotoxin storm. And because of the storm, that it has anti-inflammatory activity. It may not have any antiviral activity, but because of anti-inflammatory, it is life-saving because of that.
No, but Dr. Agarwal, does that mean everybody should take them? Surely there may be side effects. Is it okay for people to take this pill?
Okay, thank you for this question. I'm glad you asked this. Actually, there are very specific guidelines as to who has to take this, because the data available to support whether it can really protect you 100% against COVID is very flimsy. So the guidelines which came out from our Ministry of Health on around 22nd of March were very specific, that they are meant for either healthcare workers directly involved in the care of COVID patient, or the asymptomatic family members of people who've been tested COVID positive. And this is for prophylaxis. That means it's for asymptomatic people.
Correct.
It's before you develop symptoms. And these conditions are very specific. And because, again, like I said, the studies on which this data is based are, very far and scanty. So it's not for everyone.
Especially given that, Doctor, is this available over the counter? And could it be dangerous? Could it be harmful to people who may be watching the news and seeing the headlines saying that America wants them, so maybe everybody should go and take one? Is that dangerous?
Yes, that is very dangerous, because it's not a safe drug per se. It has various side effects, especially cardiac toxicity. It could even have a hypersensitivity reaction. So people should not take it, first of all, without a doctor's prescription. Secondly, if they develop any adverse effect, it has to be reported to doctors. And thirdly, like I said, it doesn't, it's not proven that it 100% protects you against the disease. So even for healthcare workers, when it is recommended, they've been told not to sort of live in under false, sort of thing that they they like no longer need to use those protective equipments, wear a mask or practice social distancing. Those have to be done. And then as an add-on thing just for healthcare workers, like an extra protection, this has been sort of advocated by Ministry of Health, but not sort of proven to
Okay, I do have more questions on this. I'd like to probe this further, but I have some callers. Satyanarayan from Hyderabad joining us. Go ahead, sir, with your question.
Sir, how do I check my immunity level? If my immunity level is high, still I am attracted to the coronavirus?
See, this immunity level will be, because this is a new virus, none of us has immunity. And this virus seems to be very infectious. As a consequence, it is spreading from one person to another person through fomites, as they say, and it stays in the fomites for a long period. As a consequence, we have no previous exposure to this virus. As a consequence, we have no previous immunity. Now, the infection seems to be mild in majority of cases. In 80% of cases, it's mild. Some 10% are admitted, and out of those 10%, some of them needs ICU. If they have predisposing condition, especially if they have predisposing conditions to the lungs, then they are at severe risk. And the deaths have occurred of those persons who are over 65. It's
No, but
not
doctor,
to say
now
that the
that
younger...
you've said that, can I just ask you, because on Saturday, the health ministry said that 42% of the corona positive cases are aged between 21 and 40 years. And I thought the literature on this, and what I certainly have been saying in the past in our shows, is that people above the age of 60, as you just said, are more vulnerable, or we see more deaths in that range.
Yeah, see, infection would occur to everybody, because since we don't have any pre-existing antibodies or immunity, infection would occur. But it is presumed that it will be mild in majority of the youngsters, and it's the serious deaths, etc., will occur in the elderly. So
All
the
right,
elderly
got it. So
needs to be more
42%
careful.
of these cases, age between 21 and 40, could be carriers, but the deaths you're saying will still be above 60. Okay, that helps. That clarifies things certainly. Rahil Rahman from Anantnag has a question. Mr. Rahman, go ahead.
Hello?
Go ahead, Mr. Rahman.
Hello?
Mr. Rahman, can you hear me?
Yes, I can hear you.
Go ahead, sir, with your question.
My question is, is COVID-19 airborne? Does it transfer through air? Although I had read many articles, before that it is not airborne, but I read 2 to 3 articles from last one day shared by many people on Twitter that it does transfer through air from one body to another. That's first question. Second one is, is there any, specific diet, etc., about COVID-19? हमें कुछ खाना चाहिए या कुछ नहीं खाना चाहिए, ऐसा कुछ है क्या?
Dr. Agarwal, perhaps you can take that question. We know that many people are concerned about this, so much so that the ICMR has actually today said in that daily press briefing that the health ministry holds every day that COVID-19 is not airborne. But clearly this is a worry for many. So could you confirm that again, not just for Mr. Rahman, but for all of our other viewers who are watching?
Okay, of course. So this is definitely not airborne in general setting. It's droplet infection, which means when we cough, sneeze, or when we talk, there are tiny droplets which come out of our mouth. So whoever is in contact, is in close contact, and gets these drops can get infection. But it doesn't stay in the air after the drops die, unlike some other infections, unlike say tuberculosis. So it's not airborne. But having said that, in hospital setting, in certain conditions, when there is aerosol generation, when we're trying to intubate a patient and other things, in those conditions, in aerosol generating condition, it could be, but it's a very different scenario. So not for general public. So do not get confused. It's not airborne. Second question was about the diet. So a lot of, I think messages have been circulating on WhatsApp and other things, what diet can boost my immunity. So I think I would like to put that, thing in a broader perspective, that immunity cannot be boosted overnight. It's not like a switch that you switch it on or off. In fact, if you have, if your immune system is in overdrive, you can actually go into a phenomenon called autoantibody formation, which is actually not healthy also. So generally, by eating a healthy diet, by staying hydrated, by leading a less stressful life, having enough sleep, light exercise, those things can keep your immunity, on the, go. And, you don't really need to and you cannot boost it, like that you go on taking certain things and you can keep on boosting it and that you will not get COVID. These are all myths.
All right. So you can't just pop a pill and have more immunity. Yeah. Thanks, Dr. Agarwal. But, Dr. Ratan, then the fact that the ICMR again has been saying that this is not airborne. Many have also said the change that we've seen in policy and the advice that we've been hearing from medical experts now across countries saying that, yes, everybody should wear a mask irrespective of whether you have symptoms or you have a cough or a cold. Wasn't that also because there was a fear that this was airborne, could be airborne?
See, it will remain temporarily in the air. So it depends on how far you... But because it is not airborne, it will not move from one end of the room to another end of the room. That means it is, you should think of droplet as an extension of the contact. But I think it's a good policy for persons who have any respiratory symptoms to have, to wear the mask. I think in Japan, it's a standard policy that anybody who has symptoms wear masks so that they do not infect others. It's not to protect yourself, but you don't contaminate the atmosphere and you don't infect others.
So wear a mask, stay 6 feet away, whether or not this is airborne or not. All right, we have a caller from South Africa, one of our viewers from South Africa, Praveen, joining us. Go ahead, Praveen. What's your question?
Good evening. I wanted to talk to Dr. Jyotsna Agrawal. I wanted to ask one question that there is a lot of things I have seen that there is the similarity of the malaria as well as the COVID-19 is almost same. So what should be a very good precaution or very good thing which will call the differentiate between malaria as well as the COVID-19. So if you can told us, so I can also guide my colleagues who is feeling malaria and they are thinking that they are a part of the COVID-19.
Good point, especially since the season of mosquitoes is now starting. You're already starting to see them and feel them.
Okay, so the patient presentation for both the diseases are not similar. For malaria, it's generally fever with chills and rigors. But whereas for COVID, it would start off with, say, sore throat and then fever, and it can go on to breathing difficulty because the complication that happens is pneumonia. So clinically, they are very two distinct diseases. I think because of the, hydrochloroquine being used as a protective, that's why people are confusing it. But there are two clinically different diseases, and there is no sort of confusion in that.
Okay. And Dr. Ratan, the fact that, we're starting to see mosquitoes, this is the time it starts getting warmer, the more mosquitoes are being seen and felt. Is that an area of concern? Could this be spread if someone is COVID-19 positive and is bitten by a mosquito who then goes and bites somebody else in the family or nearby?
No, it's not transmitted through the blood. In fact, there is a study which said that they examined persons who were positive for COVID, and they found that the maximum number of samples were in the respiratory secretion. It is excreted in the stool to a certain extent, but it's not present in the urine and it's not present in blood in the early stages. So that from mosquito bite, there's no risk of transmission of COVID. It's only through the respiratory secretions and the fomites.
Okay. Thank you, doctor. Now we have Mushtaq from Srinagar who has a question for you.
Hello, good evening.
Good evening, Mushtaq.
Yeah, I just wanted to ask about the groceries or vegetables that we purchase from the market. Are they safe to consume like that, or do we need to sanitize them in some way before consuming?
Dr. Agarwal?
I think if you can wash them properly, that would be just good enough. Wash them in running water nicely, and whatever food you've been eating, like cooked food, should be cooked properly, and it is safe because it's not transmitted by food There is a lot of, misconception about not eating eggs, not eating non-veg food. But let me clarify, it's not transmitted via any non-vegetarian food or even via egg. It could be that the person selling, if has infection or has coughed or sneezed on that, and it's deposited as droplet, then plain simple washing with running water will be good.
All right. We have Jogeshwar Rao from Hyderabad. He's a regular caller on our doctor shows. Mr. Rao, go ahead.
Good evening, Sarah again. Respected doctors, actually this question is about medicines. Several medicines have been in the news. India for hydroxychloroquine. French Sanofi claimed Plaquenil worked well. And as yesterday, Australia ivermectin, they claim that it kills the virus in 48 hours. Actually, my query is, any global agencies studying this claims of treating symptoms, which medicine is working well? Any learn from each other? That is Leo, it's called. Exercises are going on.
Dr. Ratan.
Yeah, see, one was observation that the distribution of COVID and distribution of malaria, there was very little overlap. Then the second one, as you said, ivermectin from Monash University, the information has come that COVID or SARS virus 2 is killed within 48 hours with ivermectin. Ivermectin is normally used for taking care of parasites. So one single dose seemed to be effective in vitro, but yes, it has side effects. And these are things which we should not use lightly. It should be on prescription. And more, normally they will take leads from there and then develop new drugs which will act against different stages of virus so that it is active against virus without causing toxicity. At the moment, the virus has been with us only for 3 months. It takes years for a new vaccine or a new medicine to be developed. So it is only repositioning of already developed drugs that we can use at the moment for life saving. But ordinary persons should not use it. It's only for salvage of persons who are not going to survive if something like this is not done.
Now that you put a number to it, Doctor, only been here for 3 months, it really feels like a lifetime because things have changed so much over the past 3 months. We have Shabir from Bangalore who has a question. Go ahead, Shabir.
Yeah, hi. My question is with respect to vulnerable people. I understand this particular virus has a bigger, much larger tendency to induce pneumonia faster, especially in those who are vulnerable. My question is, would anti-pneumonia vaccine help until we have a formal, proper vaccine, just as a mitigation or a preventive measure? Thank you.
Dr. Agarwal, is there an anti-pneumonia vaccine, or similarly, what about the cold flu? Sorry, okay, Dr. Ratan, could you take that? Could you take that question?
See, this is, once it goes into the lungs, then it causes pneumonia. Streptococcus, there is a good vaccine against pneumonia, which is highly recommended for children below 5 years of age and adults over 65 years of age, and it's good. But that is not a pre-existing condition. If a person has pneumonia, he would be hospitalized. While if a healthy person inhales this virus, then it will set up infection and pneumonia. So it may help. There is no harm in taking anti-pneumococcal vaccine, but it will not have any specific protection against COVID.
Well, I have a question, and we have about 3 minutes left. So quickly, let me take the last caller, Captain Emmanuel from Calicut. Go ahead, sir.
Sir, I'd like to address Dr. Ashok Ratan as well as the other lady. Now, Dr. Ratan, you belong to World Health Organization. Why can't you have mandatory powers to have a one-to-one interaction with the chief executives of all the countries, be proactive, I'm going to say you go to a Delhi army cantonment, okay? The place is absolutely sterilized on a day-to-day basis. Now, I'm not blaming WHO. The point now is we are blaming Wuhan, we are blaming XYZ. Now, it's too late, but still, the point is, why can't you call the shot? World Health Organization, as per me, sir, not only has to be proactively and preemptive, it has to have sweeping powers. If you call up President Trump, he has to comply. I would say it is worse than nuclear disaster.
Captain Emmanuel, I'm sure once this is all over, we'll probably have to do entire shows on who is responsible, what was WHO's response at the time, and was it adequate, was it enough, could everyone have done more? But we understand your angst and your concern. Many questions really arising from the spread of this pandemic, COVID-19. But I want to quickly, if I can take another caller, but I want to just ask, I think many are concerned about this one issue to both our doctors, Dr. Ratan and Dr. Agarwal. You know, many are expected to come out tonight on their balconies and be lighting candles and diyas as per what the Prime Minister has requested. So there's a lot of literature doing the rounds, a lot of WhatsApp forwards talking about the fact that we are constantly putting sanitizer on our hands, and an effective sanitizer has to have a certain amount of alcohol content. Is that dangerous? What's your view on this? What would you advise our viewers who are watching? Dr. Ratan?
I hope they would maintain the social distance whenever they come out. If they maintain social distance and use common sense, I think they should not touch anything. As a consequence, they should not come out of their house. That's one. If they are inside the house, then the chances of acquiring infection from inside the house are minimal. So I think they should do it. We should all show solidarity with the efforts that we are making.
No, Dr. Ratan, Dr. Agarwal, just to clarify, the question was about, is it dangerous to be lighting a fire, playing with matchsticks while you have sanitizer on your hands?
You should not have sanitizers during that time.
50% alcohol. Alcohol evaporates. Okay, so within a minute, alcohol is evaporated from your hands. So what is left is like no alcohol. So, I mean, if your hands are dried properly after you use sanitizer, there won't be any, alcohol left. So I don't think it's going to.
All right. So this is just a myth that people's hands will be set on fire while they're lighting these candles or diyas. But thank you so much. Both are doctors today. I think we've covered a lot of ground in this half hour. Lots of callers. Unfortunately, we've not been able to get to each and every one of them. But I want to end by repeating Dr. Ratan's words. He says, use common sense. I think that's something we should just keep repeating to ourselves in all situations. Use common sense. Thank you all for joining us today, and we hope this has been helpful for all of you, our viewers. Bye-bye.